Hello, my name is Dr. Tayo Opakunle. I'm a medical officer here at the Karen Hospital working in the Accident and Emergency and ICU. So hypertension is defined as a consistently elevated blood pressure. So the thing is, if you come to the hospital and one time your blood pressure is 150/80, we don't immediately say that you have hypertension or high blood pressure. But if every single time you're coming to the hospital, you have very high blood pressure, then we'll begin to think, okay, maybe this might be high blood pressure or hypertension. So the normal range of blood pressure usually is, if you have a blood pressure of 120 systolic over 80 diastolic, and anywhere ranging between above 90 systolic to 120 and above 60 diastolic to 80. That's the normal range of blood pressure. When we now start getting to a systolic blood pressure of between 120 to 139, we then start thinking about what's known as pre-hypertension, which is where you could possibly do some things to reverse it, but if it keeps going at this trend where it's increasing, then you'll develop full-blown hypertension. And the same thing with the diastolic pressure, where if the diastolic pressure is between 80 to 89, then you're also in a pre-hypertensive state. But now, once we get to 140/90 consistently, that's when we then say you have systemic hypertension. So this is something we commonly get as doctors, where the thing with high blood pressure is that it usually presents without symptoms, such that you could have high blood pressure for a good majority of your life and not know that you have high blood pressure. And what is usually so devastating is whenever a diagnosis of high blood pressure is made, when the very dangerous effects of it are presented to us in the hospital for the first time. This could include something like a stroke or a heart attack, for example, is where we then first realize, oh, you are having high blood pressure. So it would be important to have your blood pressure regularly checked, even if you don't have symptoms, to see if you might have high blood pressure or not. So hypertension is split up into two categories. There's primary hypertension and secondary hypertension. Now with primary hypertension, this is the kind of hypertension that a large majority of the population with hypertension has. And it's the kind of hypertension which doctors yet haven't found a real explanation as to why it develops. It's also known as idiopathic hypertension. Secondary hypertension is where there is an actual cause for why the blood pressure is elevated. And usually this is in conjunction or in combination with a certain disease condition. So a very common one, for example, would be hyperthyroidism, where the thyroid gland is overreactive and having too much thyroid hormone elevates the blood pressure. And then another common example is having kidney disease. Certain kidney diseases, because of the important function that the kidney has, causes the blood pressure to increase. But now if we go back to the more common form of hypertension, which is primary hypertension, what we've seen through doing numerous studies is that there are certain risk factors to developing primary hypertension. So one of the biggest ones is actually genetics. So we see whenever we talk to patients and we ask them, does any one of your family members have an illness? And they'll tell us, yes, my mom and my dad both had hypertension. My grandparents also had hypertension. And we've been able to show that there's a genetic link with regards to the development of hypertension. Then there are certain things in our everyday life which can contribute to hypertension. So one of them is stress. Like, it is so important to know how to deal with stress, because stress actually changes your physiology. Then a poor diet, so a diet that's very heavy in processed foods, usually is something that, and with regards to processed foods, a diet that's also very high in sodium or salt intake is something that predisposes you to hypertension. Then being overweight or obese, because as your weight increases, your heart has to work harder, and as a result of that, that increases your blood pressure. Then certain habits like excessive alcohol intake is something which also can lead to the development of hypertension. So there are numerous things that can be done to help lower your blood pressure if you already have hypertension. Some of these things include regular visits to your physician or your cardiologist, who can alter your medication as they see fit, depending on if you're responding to your medication to lower your blood pressure. Then the next thing would be actually taking your medication. Because one thing that we see, as we had talked about earlier, is that because there are no symptoms, it feels like it doesn't make sense to be taking medication for something I don't feel. But it's incredibly important that once you've been started on your antihypertensive medication, to keep taking it. Then there's some very key lifestyle modifications that can be made that will help to lower your blood pressure. One of them being regular cardiovascular exercise. So some form of exercise that gets your heart beating, that gets you to sweat. It could be walking, it could be running, it could be playing sports with your friends and family, just anything that gets you moving. Because as the heart gets stronger, as your cardiovascular system adapts to aerobic exercise, it becomes a lot more efficient at controlling your blood pressure. Then the other thing is diet. Diet is so important with regards to lowering your blood pressure. And in fact, if you are interested, one thing that you could look up is something known as the DASH diet, or the diet associated with eliminating systemic hypertension. And usually, for the most part, most good diets usually include numerous servings of fresh fruits and vegetables in what you're eating, reducing a lot of refined starches. So if you can take things like, okay, no, let me just go with reducing refined or processed thingies. So this includes numerous servings of fresh fruits and vegetables in your meals, reducing how much processed food that you intake. As we discussed earlier, a lot of processed food is very high in sodium, which contributes to your blood pressure increasing. And then the consumption of healthy lean meats, such as good lean red meat or fish or chicken as well. Of course, not fried. You can't exactly say you're being healthy if you're eating fried chicken every day, even though chicken is a very healthy source of protein. And then last but not least would be stress reduction or stress management, because you could do everything that we've talked about. Visit your doctor, be taking your medications, you're exercising regularly, you're eating well. But if you get extremely angry at work or at any of the difficult situations that life throws at you, your blood pressure increases, and your body recognizes when you're under a lot of psychological stress. So if this involves either doing some form of meditation, going to actually speak to your therapist or your counselor, confiding in family or friends or just somebody who you trust, just anything to help reduce that mental stress, that will go a very long way to reducing your hypertension. As well as also, if you work a stressful job, seeing what you can do to mitigate that stress while you're at work.